and social care. But first, it gives me great pleasure to invite Johanna Baxter to move the annual report on the policy document. Johanna.
Chair, Conference, Johanna Baxter, very proud to stand here as one of your representatives on our National Executive Committee. Conference, we've all been on the Labour doorstep, we've knocked on doors, we've met voters who have lost faith in the power of politics to change their lives. And is it any wonder when you have people like David Cameron who say one thing before a general election and do something completely different afterwards? David Cameron, who said, "I'll stop top-down reorganisations of the NHS. I'll cut the deficit, not the NHS. I'll have a bonfire of the quangos." The same David Cameron who then leads this coalition through the lobbies of the Houses of Parliament and presided over the biggest reorganisation our NHS has seen in its lifetime, who's created one of the largest quangos the country has ever seen, and who has put competition before patient care. And Conference, he did that without a moment's hesitation, against the advice of healthcare professionals, those on the front line, doctors, nurses, hundreds of thousands of members of the public, people like you who are seeking to protect our most precious national institution. Without a thought for the House of Lords, who defied him, sent him a message, and voting against the government at the very first vote. And without a thought for the patients who now are waiting longer, in pain and more discomfort. People who are paying the price of David Cameron's disastrous decision. He was warned, Conference, he was warned repeatedly by healthcare professionals against going down this course. But he chose to put his political pride before the best interests of patients. So, Conference, when you meet that sceptical voter on the doorstep, I want you to talk to them about the NHS, because this is the dividing line. We know that a government's central responsibility is to look after the care of its nation. We know that universal access to healthcare, free at the point of need, should be a fundamental right in a mature society. We know that our NHS is one of our nation's most important institutions. It embodies fairness and equality of opportunity for everybody. And that's why this party has been listening to the people who know the NHS best, the people who work in it. And it's this party, Conference, thanks to our excellent shadow team, are absolutely clear on where we stand with the NHS. We fought the Health and Social Care Act every step of the way. We laid amendments, we worked with the House of Lords, we listened to professionals, and we appealed to the best interests of those in other parties. And we haven't stopped when it became law. We know what we're going to do when we take office. We will repeal the bill. We will repeal the bill. And we will put the NHS back right where Danny Boyle had it, that glorious opening ceremony night. Right back at the heart of our national story, back to being a world-class institution that countries around the world look up to, back to being the pride of Britain. So thank you, Danny Boyle. And I want to thank Andy Burnham today for his leadership. Because, Conference, in Andy, we could not have a more vigorous, passionate defender of our National Health Service. He's absolutely the best person to be in that position today. Now, Conference, before I finish, you might ask why I've said so little about the actions of that other coalition partner, the Liberal Democrats. That's because there really is only one thing to say. So Nick Clegg, if you're listening, let me tell you this. All the apologies in all the world will not make up for the fact that you walked in the shadows of the Tories through that lobby to privatise our most precious national resource. The electorate will not forget that. The electorate will not forgive that. And Conference, we know there is only one party of the NHS. You can't trust the Tories with the NHS. It's this party, Conference. It's the Labour Party who are the party of the NHS. I move the report.
Johanna, thank you. You brought a great deal of passion to that speech, and I'm sure it's the first of many passionate speeches we're going to hear in this debate. We're now going to take Contemporary Composite 4 on health and social care. So can I ask Kingston